Welcome back to County Connection. For our final segment of our April episode, we are going to be talking about National Public Health Week with the Director of Summit County Public Health, Amy Wineland. Welcome, Amy.
Thank you. Thanks for having me.
Amy is in charge of a dizzying array of great programs and resources at the Summit County Public Health Department, and National Public Health Week celebrates that. Amy, tell us what this week is all about.
Sure. Well, it's going to be on April 6th through the 12th. It's always the first full week of April.
Okay.
And it's really an opportunity for communities across the nation to recognize the contributions that public health makes to the community, as well as highlight some important issues that impact our health. This year marks the 20th anniversary of National Public Health Week, and the theme this year is really to emphasize partnerships and connections with community partners to improve the health of our nation. The goal is to become the healthiest nation in the world by 2013.
That's a great goal and an ambitious one.
Very ambitious goal. And despite what people hear or read about our health, Americans are some of the most unhealthy people in the world. We actually spend more on healthcare costs, yet live shorter lives and suffer more health issues than our peers in other nations.
Wow.
Yeah, that's really alarming. 1 million Americans die due to preventable chronic diseases every year, things like diabetes or heart disease. And good health doesn't come by chance. It's something that needs to be nurtured. It's really connecting us through our environments where we work, where we live, where we learn, where we play. And so, it's really also tied to the resources that are available in our community. And research shows us that undoubtedly it is absolutely linked to access to health care. And certainly the implementation of the Affordable Care Act will make some impact in this area, but it is not enough to really cut down the cost of health care, curb disease, or really create us to be a healthier nation. So to become the healthiest nation in one generation, which is the goal, it's challenging work, and it'll take more than public health professionals. It'll also take more than asking individuals to make healthy choices, especially when there are other challenges involved like poverty, poor education, housing, environmental factors, which have profound impacts on our health. And so, for example, you can go into the doctor's office and be treated for obesity and diabetes, but to solve the problem of the cost of the health care, both monetarily and to our health, to our health as a population, it can't be solved there. It really, to tackle these conditions, these preventable conditions, it's going to take increasing access to affordable and healthy food. It's about planning land use appropriately to increase physical activity and encourage physical activity. It's about educating the population on good nutrition and sound nutrition, science-based evidence. It's about working with the industry and the schools and employers to come up with common solutions, and then it's also about collecting the data to see what works. So you're really talking about all of society, really all pieces and parts of society kind of chipping in and contributing towards these goals. Right, and so this is what we would call a resilient public health system, and it really is critical and crucial to impact the health of our community and larger populations. So it's really about building coalitions and collaborations with public and private and nonprofit and schools, organizations and schools and policymakers and any other area or agency within the community that's impacting our health. Right. So this sounds kind of daunting, but there are some great examples in this country of public health victories where
all these different segments of society really have come together to have some wins. So can you tell us about a few of those?
Yeah, absolutely. One is the fight against big tobacco. This could not have been accomplished, and the fight was really instigated by all the deaths that were occurring with tobacco, and the goal was to really decrease tobacco use in the country, and it wouldn't have been possible without, broad community coalitions, public health groups, economists, scientists, educators, policymakers, to come together and work on this goal together. And there are other victories, such as immunizations and fluoridation, and one that's highly recognizable is the use of seatbelts. That was a all hands on deck kind of approach that took all of those entities, as well as some that you might not think of, car manufacturers and highway planning, to make roads safer, as well as big, large educational campaigns on the importance of seatbelt use.
Sure, and a lot of those victories really are hugely transformative. I mean, you just sort of take seatbelts for granted nowadays, or the fact that you can go to a restaurant and not have somebody smoking next to you. So some really big victories for sure. Huge victories,
and yet it's also really important, and we want to emphasize this during Public Health Awareness Week as well, is that the public health system work is never done. And so, just as I've talked about some of these victories, we're now going back again to fight big tobacco, because if we have e-cigarettes that are out now and targeting our youth to get a whole other generation hooked on nicotine. And we have our cell phones that we depend on so much, but they've created a problem with our driving safety in terms of distracted driving.
Right.
And so, even though we have these amazing victories, we continue to work as issues arise.
Right. So to take it back down to Summit County, what should we know about public health locally?
Sure. Well, many of you might not know we exist, and that's okay, but I hope you know that your lives are better and safer because of the foodborne illness that we prevent, and safe water that we have to drink, and communicable disease that we prevent. And others might have had personal experiences with some of our programs. They may have come in for a flu shot, or come in for nutritional counseling with our WIC program, or had a nurse visit. We offer so many, such an array, as you mentioned before, of services, and I would encourage anyone to go onto our website to see really the vast amount of work that we do. We will be producing our 2014 annual report, which is our second issue of our annual report, and it will be coming out actually the week after spring break. Public Health Week is during spring break, so we want to make sure that people are able to see our report. It'll come out in the Daily on Tax Day, April 15th, so hopefully you will have a chance to look at that. And the emphasis this year, along with National Public Health Week Awareness, is really talking about the partnerships that we have in our community, those that we've strengthened in 2014, as well as new partnerships that we have had in the past year, and what some of the great work that's been accomplished during that time.
Can you give us some examples of those partnerships?
Absolutely. So one example is our community garden donation program. This was a partnership through our WIC program, which is our Women, Infant, and Children program. It's a food supplemental program for low-income women, pregnant women, and children up to age 5. So it was our WIC program, the High Country Conservation, Mountain Roots, FERC, which is our Family and Intercultural Resource Center, and some community members who came together to work on a food donation program so that fresh herbs and vegetables from all of the community gardens within Summit County, anyone who wanted to donate extra produce could put it in a cooler, and then we had community volunteers who would pick the food up and bring it to our office, and then we were able to give fresh fresh vegetables out to our WIC families. We gave 708 bags.
That's amazing.
Stuffed full bags of vegetables and all sorts of things, of course. And some of them, you know, even our staff had never even tried. And so what was so great about that was that when some of our families would come in for their nutrition counseling, our dietitian, Whitney Smith, had already pre-planned, you know, she knew what vegetables we were going to be getting that week, so she was able to come up with recipes and ways to prepare the food so that she could educate the families not only on the nutritional value of what they were going to get that day, but also how to prepare it at home.
Oh, that's great.
And in addition to that, the clients would send us pictures of how they utilize the food that we were giving, because it was really important for us to know and to see, you know, that the food was actually going to be used. So the other thing about that collaboration partnership was that we had WIC families that could go down to the garden, and they had nutritional classes down there, like actually at the garden, so they could see where their food was coming from. They could partake in harvesting, you know, some of the vegetables, the fun to pick vegetables, you know, like the peas and pull the carrots and things like that. So it was a huge example of successful collaboration. You know, in public health, we're supposed to be, you know, the public health mission is to really look at the whole population of Summit County and to make sure that and ensure their health. But it's a monumental task, and we can't do it without partnerships such as these. And so our annual report will highlight many others that we had in 2014.
Excellent. Well, that'll be a great thing to keep an eye out for then on April 15th. Is that what you said?
April 15th,
Okay, in the Summit Daily News, so be sure to check that out. So you've kind of gotten at the fact that all of us really are involved in public health, or can be in one way or another. So tell us about some of those small steps that members of our community can take, and then potentially, once you've maybe checked those off the list, some bigger ones.
Sure. Well, I have a whole list of things in my head that come to mind. One would be, you know, to really make sure that you're up to date on your immunizations. Immunizations prevent 33,000 deaths a year and 14 million communicable diseases. So it's really important to make sure that you're following what the recommendations are for immunizations. Installing fire alarms in your home, as well as carbon monoxide alarms on every level of your home, would be something that you could do. Most deaths from fires happen in the home, and 2/3 of those deaths occur in homes where the fire alarm wasn't working properly. And so it's really important to make sure that you're checking those on a regular basis.
Right.
Fall prevention is one of our main priorities here in Summit County. And, you know, injury-related deaths because of falls are the leading cause of deaths in people 65 and older. Okay. And $65 billion of healthcare costs go toward falls to treat injuries from falls.
Yeah, and I know we've had our community and senior center is working a little bit on that.
Yes, they're doing the Remembering When program, and so they can come out and do a home visit if you're wondering. It's important to assess your home and a loved one's home for uneven flooring or poor lighting or things like that might be the cause of a fall. Okay. Water fluoridation is another one. You know, it's been a huge success of public health in the past few decades, and can decrease tooth decay up to 25%. Every dollar spent on fluoridation saves $61 in dental care. And that's really important to know that here in Summit County, because we have many of our water districts do not fluoridate their water or are no longer fluoridating their water. Right. We also have many of our residents who use well water. And so it's really important to understand whether you're living in a neighborhood that's not getting water fluoridation, or have your well tested to make sure that there are ample amounts of fluoride for the protective factor to take effect. Otherwise, talk to your healthcare provider, and you might need fluoride supplementation. And then in the bigger picture, you could go to your town or your water district board and talk to them about considering or reconsidering doing water fluoridation. There's the foodborne illness. 1 in 6 Americans get sick from consuming contaminated food or water every year. And so it's really important to be up to date on, food handling and correct cooking techniques to make sure that you prevent foodborne illness. And then if you do suspect that you have a foodborne illness from one of our wonderful restaurants, or know that it is a reportable illness.
Okay.
And it will help us protect the rest of the community if we can look into that and make sure that there's some training, if training needs to happen or something else, that we can follow through with that. So fewer than 15% of adults and 10% of adolescents get the recommended amount of fruits and vegetables a day. And so one thing you could do would be to stock up on more fresh fruits and vegetables in your kitchen, and maybe less of the things that are high in sugar or high fat.
I've been trying to do that on half my plate, fruits and vegetables.
Yeah, you got it. That's right. Well, let's see. Motor vehicle accidents, we kind of talked about that, but distracting driving causes 33,000 deaths a year.
Wow.
And more than 400,000 injuries. And so, you could take a pledge to not use your phone in the car. Difficult to do, I know, but
I've heard
it's
people
really important.
throw it in the back seat so they can't reach it.
That's a good idea. Make sure to always wear your seatbelt, no matter what the distance is that you're driving, because the deaths due to car accidents, over half of them actually, folks aren't wearing their seatbelts.
Okay.
So that's really important. Along with motor vehicle accidents, there are a lot of deaths and injuries to children, and if children are in the proper restraining seat, car seat, they can reduce the risk by 71% in an infant and 54% in a 1 to 4 year old if they're in the proper seat. So one thing that our community members could do would be to make sure that they're in the proper seat for the child's height and weight.
Okay.
They can also go to many of our several car seat safety technicians to make sure that it's installed properly. And then if they want to, if they've checked those off their list, they could organize, an educational session with one of our technicians to come to their child care center or one of their schools and meet with parents and talk to them about the proper use of car seats.
Fabulous. Well, those are all some great steps, and I know that when I've spent time on the Summit County Public Health website, there is just an amazing amount of information there, and then also links to a lot of great public health resources like the CDC and the Centers for Disease Control, and then the state CDPHE, Colorado Department of Public Health and Environment.
Public Health and Environment, yes.
So how about some other resources are there any others that you would mention to folks in terms of learning more about steps that they can take in some of these issues?
Sure. Well, they can definitely get on to Public Health Week website. They can also call us at Summit County Public Health, and we can let them know of other resources available in our community for any of the topics we've discussed here or any others that they see in our Public Health Improvement Plan or our health assessment.
All right, fantastic. Well, is there anything that you would like to add as we head out there and celebrate National Public Health Week?
I guess hug your public health professionals.
All right, here, I'll give you a hug.
Oh, thanks.
All right, well, thanks to those of you at home who have joined us for the April episode of County Connection. We hope you've taken away some good nuggets about services and programs and events that we have going on in Summit County, and we will see you next month.